Hi, this is Dr. Lara. Today we're going to talk about a topic that's a little more serious than our typical ones, oral cancer. Oral cancer is a very serious disease that affects at least 50,000 new people in the United States every year. Approximately 1 person per hour dies from oral cancer. So what is oral cancer? Oral cancer is any type of cancer that occurs inside the mouth. Now, this can encompass a lot of different things. In general, we're talking about cancers that start on the outer surface of the lining of the inside of the mouth. Most of these cancers, more than 90% of them, are squamous cell carcinoma, which is the same as a type of skin cancer. There are other types of cancers that are less common in the mouth. In general, the types of cancers that we see starting on the sides of the tongue, on the gums, on the floor of the mouth, and on the cheeks are going to be these squamous cell carcinomas. Well, what causes oral cancer? When we talk about the causes of oral cancer, we basically have to divide it into two different concepts of oral cancer. Traditionally, oral cancer has been known as a disease that affected old white men who used tobacco and drank alcohol. That's the stereotypical demographic for traditional oral cancer. The problem is oral cancer is changing. There is a new type of oral cancer, and the cause of this new type is the human papillomavirus. You may have heard of it, HPV. HPV is also a virus that is linked to cervical cancer in women. This is a sexually transmitted infection, and it has been linked with many of these new types of oral cancer. The difference is that they are happening in younger people with no preference for gender and no history of alcohol and tobacco abuse. They also occur in a different location in the mouth. The new types of oral cancer are showing up toward the back of the tongue and the entrance to the throat. The old traditional types of oral cancer were most commonly seen on the sides of the tongue, the underside of the tongue, the floor of the mouth, and sometimes in the cheeks. As far as risk factors for oral cancer go, I've mentioned a few already. Tobacco use is a big risk factor for oral cancer. Smokeless tobacco like dip or snuff, chewing tobacco, and even smoking have a very strong link with oral cancer. That risk factor of tobacco use is exponentially increased when you also drink alcohol. Another risk factor for oral cancer that affects older people is chronic oral infections. This does include cavities and gum disease. So anyone who has dealt with lots of untreated dental disease is going to be at a higher risk for developing oral cancer than someone whose mouth has been healthy throughout their whole life. The other risk factor that I've already mentioned is HPV infection. Now, most people, their bodies will clear the HPV virus within about 2 years, so not everyone who is infected with the HPV virus will get oral cancer. In fact, it's a very low number. It does have an increased risk though. So what can you do to reduce your risk of oral cancer? Basically, rule out those things that I've mentioned as risk factors. Don't use any tobacco products. If you do, quit. Do not abuse alcohol. Alcohol abuse is considered, heavy drinking is considered anything more than 6 drinks per day. And deal with any dental disease that you have. Make sure that you are not allowing chronic dental infections to run rampant in your mouth. As far as the HPV infection goes, we do know that the risk of the dangerous types of the human papillomavirus that are more closely linked with cancers, the risk of acquiring those strains of the virus goes up with the more sexual partners you have. So practicing safe sex will reduce that risk of oral cancer that comes from human papillomavirus. Oral cancer is typically has a much higher survival rate the earlier you catch it. This is what makes regular dental checkups so important. At every dental evaluation you have at Definition Dental, we perform an oral cancer screening. When we can catch it early, your long-term survival rate is very high. So don't miss a dental checkup so that we can confirm that you're getting an oral cancer screening at least every 6 months. There is a lot more information in the blog below, so please read for more details and give us a call if you have more questions about oral cancer. Thank you for watching. Have a great day.